Texas. Mr. Arrington, for purposes of an opening statement.
Thank you, Mr. Chairman. Listen to these startling statistics. The Kaiser Family Foundation says 3 in 10 Americans skip filling their prescription or taking their medication as prescribed due to prohibitive cost. 1 in 4 seniors on Medicare report difficulty affording their prescription drugs. In another study, 75% of patients reported receiving a prescription that cost more than they expected. Look, if we're going to have a healthy and competitive market in healthcare, which I believe, Chairman, is the best way to create value for the American people, quality and cost they can afford, we've got to have transparency in pricing, and we have to have information for the consumer that is meaningful in order for them to shop for themselves and their families and make the decision and the choice as to which drug will meet their needs and their budget constraints. No such healthy market or price transparency exists today. And when consumers engage in a normal market, there is transparency. Our consumers have bargaining power, they assess value, and they shop around and they get the best deal for their families. 5 years ago, we passed a bill, bipartisan bill, called the Shop RX Act. And it simply gives CMS data to the public for the purpose of figuring out which product that these families need and can afford. And it was never implemented. 5 years, we've deprived seniors from getting good information. And here's what we know about this information and what it does to the pocketbooks of our seniors, most of whom are on a fixed income. CVS implemented a real-time technology program. They saw physicians switch to a lower-cost alternative almost half the time. And it resulted in an average of $130 per prescription for our seniors in reduction in cost. $130 per prescription in the pockets of my mom and dad and your parents and grandparents and our beloved seniors. And the CMS didn't even implement it. 4 years later, we're having to pass a bill now to basically, and it's called the Real-Time Benefit Tool Implementation Act, because they won't implement it. And for the life of me, I don't understand. And I would just say that this is why it's important for all of us to take our oversight responsibility seriously, because if we don't follow up and follow through with our oversight responsibility, then a lot of things don't get done, and a lot of people get hurt or are not well served, and they certainly don't get the benefit of our lawmaking, and in this case, bipartisan legislation to help our seniors. So, Mr. Chairman, this act is going to force their hand, sadly enough, to do what they should have done 4 years ago, and I believe it's not the panacea for all that ails our healthcare system, but it will make it more market-oriented, and it will empower our consumers, and our seniors will be well served. I appreciate the opportunity to lead on this, and I'm grateful for Jimmy Panetta from the Salad Bowl of California, and for his willingness to slay this dragon and serve our seniors. So Jimmy Panetta, thank you very much. Mr. Chairman, I yield back.
Thank you. I now